So, how do we improve the way care is delivered, supported, and experienced? And how do we do that? Well, I think it's done by redesigning patient staff experiences through the use of technology. And I'm really excited where we are in healthcare right now. It should be seamless. Care journeys should be frictionless. Clinicians should have the data before they need it. Operations should be powered by automation. Every interaction that we do is done with purpose, supported by data and intelligence, and obviously a thoughtful design at the beginning of its life cycle. Care should become safer, faster, and most importantly, more personalized for organizations that lean into this kind of digital.
Welcome back to Level Up. I want to go back, to the early beginning. Start with your journey. How did you first step into the world of healthcare and technologies?
Yeah, it's a great question. I think early on, as a young whippersnapper coming out of high school, I wanted to pick a career that was long lasting, so to speak. And, I've come from a family of nurses. In fact, my family actually owned a nursing home growing up. So we called it the White House. We had the East, the West Wing, and I was always kind of brought up in that kind of healthcare perspective. That was from the women's perspective, and obviously my great-grandfather was administrator, but also we owned multiple manufacturing design companies, so it gave me a little bit of an engineering and, I think that's where I got some of my technical aspects. So long story short, it was kind of bedded in within me, and choosing where I wanted to go from a healthcare perspective, I first wanted to be a physician, and I talked myself out of that knowing amount of potential debt I was going to go into going through the multiple stages of schooling and college. So I landed on technology. I landed where I could both be someone that could facilitate, help drive outcomes in patient care without being the one that's delivering patient care, so to speak.
Really interesting. So it wasn't the family already, like it's all in the family. But did you had a doubt, or there was like that moment that you said, okay, this is really what I want. I want to go continue that path, and you take it from there.
Yeah, I mean, I started early on as kind of an intern in healthcare. And early days on, I knew from the first surgery that I was an intern in that it was something I was passionate about. And I don't think it really clicked from a tech perspective until I was working for one of the largest healthcare information technology companies at this time. And I think this is where we kind of crossed paths was Cerner
Yeah.
Corporation. And it was early days. The CEO and president at that time was Neil Patterson. And he had some family challenges in his own personal space that really pushed our endeavors to move sepsis throughout our technology at that time. And I was on the early phases of being one of them that would test the software to make sure that it was triggering based upon the multiple criteria. And I realized at this point that something so small as testing software could have a large impact from a patient care's perspective. Not only led me into where we can tick and tie tech from a healthcare outcome perspective, but it also tick and tied the fact of automation and where we could go with this. And, that next journey from making sure that the system is firing sepsis alerts, but also driving down automation to make sure that the automation of the 5 rights and medications were tested successfully without a human ever stepping into a facility. Those were kind of two moments for me that led me to believe that I'm in it to win it, so to speak, and I wanted to stay with this journey from a long-term perspective.
Really inspiring. And I think the industry or the segment you're in is really the most important. Doing something, effective and really helping people's lives, which absolutely the best you could do. You've been, of course, in that journey, and now you are leading an innovation and really leading a change at the Southwestern Hospital and Clinic. From your experience across different institutions and roles, what were the key lessons that shaped your leadership style?
I mean, there's many, right? And I always say, I have some of the scars and the bruises and the
Yeah,
cuts to kind of prove that. But I think it boils, if I would kind of try to sum it or boil it down, it's listen, listen deeply. The people closest to the work understand it the most. They understand the problems. And
yeah,
as a leader and as a growing leader, it's always good to keep your ears close to the ground as you can.
really
And I
good.
there's a large place in AI right now where if you can't explain it, you probably don't want to implement it, right? So I think that also goes off of in any aspect is simplify and not just simplify, but simplify relentlessly, right? Because complexity, I would argue, is the enemy of adoption. If I don't understand it, if it's difficult to digest, you kind of want to go arm's reach away right off the jump. And then I think from a leadership perspective, and I talk about this, is always about lead with transparency, right? Because I think
Nice.
trust is the fuel that will keep that engine from a leadership perspective continuously burning.
It's really strong. Leading with transparency, I think, is absolutely deep. It also reflects lots of meanings, lots of different aspects of any leadership. And I think, especially with the AI and the technology and the world we're living in, it's even more important to be, close to your teams. I'm interested. How does your day look like? Like a normal day in your position, in your level, how does it look like?
Yeah, I mean, a normal day, a lot of emails, a lot of meetings, a lot of discussions, keep things on track, move things back on track, identifying risks, mitigating issues. And that's just on a typical Monday, right?
Yeah.
But I think more importantly, it's about, every morning I make it a fact to walk down with my team.
Nice.
I reside on the other side of the building, and I want to make sure that I go talk to my team, shake the hands of my team, take a moment to have a cup of Joe and just listen, right? And I'm finding out that the more I stay embedded with my team, the more ability I have to course correct before a problem becomes a problem. And I think to your point about our conversation earlier about trust and how do you lead, I think it just adds in that journey because I know that the team actually knows that I have their back, so to speak. When push comes to shove, or when we get into a little bit of a risky situation from project perspective or an operations perspective, the team knows that I'm going to be there and I'm going to help them. And I think that reciprocal relationship is what allows, well, at least my experience with my team, to remain plentiful, purpose, and honestly, just ensuring that we continue to have fun as we transform healthcare in today's age.
It's really direct to the point, and you're close to your team. I think also you said really important aspect is the team depends on you. The team knows that you got the back, and I think in our world, and especially when you have a live operation and issues and problems, it's really important to know that your leader is backing you up, because that also gives a trust, gives the motivation and the drive for the teams to actually do their absolute best. Nice to hear. And I want to move to a really quite interesting section, the digital transformation in healthcare. Of course, it's a hot topic. Everybody talks about it, how it's going to change, but it's really nice to have somebody in the playground really doing this every day. So digital transformation is a big buzzword, but in your world, it's very real. How do you define it when it comes to healthcare?
Yeah, I mean, it's a great question, right? Like when Uber came along, they didn't design anything new, they didn't create anything new. We still had a need for transportation. There was still apps and technology, and there were still cab drivers, right? They kind of just connected it,
The world, yeah.
did a different way to do the same business, right? And I don't, there's no need to change that lens per se from a healthcare perspective, but to me, it's fundamental. How do we improve the way care is delivered, supported, and experienced? And how do we do that? Well, I think it's done by redesigning patient staff experiences through the use of technology, through data driven mechanisms. And I'm really excited where we are in healthcare right now. And I think all of us from a leadership perspective in IT probably wish it was further. But I believe we're at this pivotal moment right now in healthcare. I'm excited to talk to you about it further today.
Yeah, definitely. I think looking back at, let's say, 10 years ago, before the rise of AI and automation, I'm sure this is a better world for you, definitely, with a lot of probably admin, less work, and more time with patients and more time to do really meaningful things. So, at Southwest General, what are some of the most impactful digital initiatives you have leading or you're leading now?
Yeah, I mean, over the past, I've been with the organization since 2022. I've been fortunate enough to move into my leadership role last August. So just a little over a year and 4 months been in this role. But what we've been able to accomplish is starting at the infrastructure, moving from a three-tiered architecture to hyperconverge, ensuring that all of our infrastructure is the most up to date per our capital plan. In addition to that, making sure we have right, tight, best fit, not best in class, but best fit from a disaster recovery perspective. So then we know anything that we build on top of that infrastructure is going to allow for scalability, security, etc. And I think from there going forward, we've been focusing on, the buzzword. How do we get AI agents working on behalf of my clinicians? How do I get AI agents augmenting non-clinician staff areas? So we've been able to drive through ambient listening or digital scribing with one of our partners, Oracle. We've been live with our AI capabilities in the ambient listening space for inpatient, outpatients, and the ED February. We've been able to actually show some great driving metrics where we're getting ROI back of that. And yes, it's from layers of operationally, but I think kind of our thread that we've been talking through here has been about technology is actually driving better patient engagement and better human interaction than it ever has before. And I think that to me is the secret sauce or the magic sauce in this is because our organization felt the value, saw the value, and we were able to drive through the implementation arm that our doctors and their relationships with their patients are getting better because
Wow.
our doctors are focusing more on the patient and not so much about remembering everything in the clinic visit that the patient have said and being able to regurgitate that back in the medical record where we have automation through AI supporting in that aspect. So that's kind of the clinical Raptor, and there's a much more areas where we're doing it, but we're also focusing on kind of the administration and that kind of intake. So patients have a more personalized experience and have an ease of access to do business with us in the unfortunate fit that they do become sick or ill.
Definitely. Wow. This is absolutely how it should be, like listening and also experiencing myself as patient going to the hospital. So thinking of what you're saying, also, reducing all the admin work when you arrive to the hospital, because there is a lot of automation involved, gives that, quality time, I would say, with the doctors and the patients together, which absolutely I think something was missing from my own experience. I don't know a lot about healthcare, or I didn't experience it myself in the States, but being in the Middle East, going to a hospital, before you even have the check in, you're already so tired, waiting and signing and filling up. So absolutely, I think is important aspect of the future of healthcare. How do you measure actually success in a digital project? Is it data, patient feedback, stuff adaptation, or what is it?
Yeah, I mean, I think you hit it. It's, being bound by healthcare being, we are a nonprofit organization. We want to make sure that every dollar we spend, we get at least five back. ROI and value are very enriched and based of what we do. And
Hmm.
those metrics, those hard metrics have to line up before we enact or invest in a project or a strategic investment. So I think it's making sure you have the hard metrics, adoption, throughput, and ROI from a financial perspective, but you also need to focus on some of those experience things, looking both internal and external, both staff and patients, and getting that qualitative feedback. If you can course correct, in addition to those hard metrics, and then I also think it's all about the why, making sure everybody knows the why. And if you stop anybody in the elevator or in the halls and you have a bit of that conversation, that they can say, yeah, I know why we're doing this. And we know what are some of those aspects from an outcome perspective that we're going to obtain. And I look at that both qualitatively and quantitatively.
Interesting, really interesting. Of course, digital transformation isn't just about data and numbers and tools, but also it's about people. Of course, there's a important aspect of the people getting involved. So how do you bring your teams along through that change actually?
Yeah, I mean, I think we've kind of tiptoed up on it earlier. One, getting those teams bought into the why on the front end,
Mm.
around that business case time frame, right? Putting that charter together and really driving the what, the why, and then obviously the who. And as I mentioned before, it's showing them with other initiatives that you've come that the human element, it's all going to be wrapped in kind of this human element, both for staff as well as for patients. And as I said before, it's driving that message that tech is here to purposeful tech implementation is here to support, not replace. We're here to augment. And I think if you do those and you do those eloquently, that you'll be able to get the staff behind you, those that are mostly impacted, as well as those are going to implement. And I think you won't lose focus on that kind of human touch in healthcare. And as I said before, what we're seeing here is the opposite. Because we've implemented smart technology, we're actually increasing the human touch that we have with our patients. And I think if we can take that silver lining and apply it to all the implementations from investment perspective, that we definitely will be winning in ensuring that that human touch is there as we develop more and as we develop more into our strategy going forward.
Very interesting. Very interesting. Like thinking ahead, future of healthcare and technology. Of course, it's something we all think about. We don't know what is going to happen, and AI is it going to take jobs, and all those very famous topics in any industry or anywhere. So if we fast forward 5 years, what does truly digital first hospital or health system looks like to you?
Yeah, I mean, at its core, it should be seamless. Care journeys should be frictionless. Clinicians should have the data before they need it. Operations should be powered by automation. We should be reducing the amount of manual work that you have in your organization. Every interaction that we do is done with purpose. It's supported by data and intelligence, and obviously a thoughtful design at the beginning of its life cycle. Care should become safer, faster, and most importantly, more personalized for organizations that lean into this kind of digital first. And I think, Hakeem, what's interesting is where we met, right? I was a very young gentleman 15 years ago,
You're
you know,
still, you're still, you're still young.
yeah, I feel you. Hopping on a plane, moving to a new country where the country said, we will be the best academic, medical, and research center in the world, right? Opening the doors with zero paper. We built the organization from a design perspective to be digitally first from the day it saw its first patients. And I lived that world for about 10 years. And I think I never want to lose sight over having the fortunate ability to join and work for an organization that understood the power of innovation, understood that innovation, what it could do for its patient population in its country, but not only in its country, but the globe.
Yeah.
And I think just holding on to that moving forward will help propel on what's coming around the corner in 5 years. You've touched upon kind of the data aspects of it, predictive, automated, all integrated systems. And I think really what this is going to come to, Akeem, is we're going to start creating a digital me, a digital you, a digital where based upon all the digital points that these large computation models have, or a different infrastructure that we'll have to start to purchase to run these. But basically, at the end of the day, the digital you would get an illness, it gets sick. You get notified on your healthcare app that you're going to get gout, let's just say in 2 weeks. And if you don't want to get that ailment, here's your regimen that you need to follow. That's where I see, yes, we might not get there in 5 years, but I believe with all of the AI, the data analytics, that we're going to be coming to the point where we're going to keep people out of the four corners or bricks and mortar of the organization and healthier through prediction.
Incredible, really. I'm also excited about, of course, the future. Of course, there's a lot of fears and people think about how it's gonna take a job and take jobs, but also I think it will create a lot of jobs as well, and it will create that what you said, that space where people can really connect more together because you can really automate a lot of things. In my industry, in my where I work in hospitality, it's really gonna make a change because we in hospitality waste lots of time doing admin stuff. Has nothing to do with anything, but definitely the rise of AI really helped reducing that amount. And I'm sure it's even more important in healthcare because this is where actually the personal connection is much more important because it can save a life, definitely. So it's really good to hear. Jay, where do you see the biggest opportunities for innovation in the future?
I mean, it's a good question. And I think to me, this isn't so much about the future, but more about the right now, right?
Yeah.
And It's all about those touch points where patients are trying to get access to or information from, right? So scheduling, registration, insurance, clinical documentations, the portals. And then I think from an internal or from an organization perspective, it's how do I get more throughput? How do I
Mm,
retain revenue? How do I streamline coordination, right? How do I get better digital outreach? And then from an analytics layer, how do I get good predictive diagnostics insights that will help me make better decisions on today, but also help me see around the corner in the future so I can continue to make driven and intelligent insights as we move forward.
I would definitely not let this go before asking you what advice would you give to young professionals entering healthcare take leadership today?
Yeah, one, don't take things too personally. The resilience is at the top of that totem pole, right? You don't need to have everything figured out. You will figure it out. Build relationships, focus on communications, be curious, be adaptive. And I feel as you do that, you'll start to build credibility and the rest will do the magic for you.
Nice.
That's some advice that I would give a young professional entering into healthcare today.
What motivates you every day? When you wake up, something that drives you to go out and, do your job?
I mean, my family. And I know
Nice.
it's an easy button, but it's the truth, right? I want to be someone in my household that leads by example. And I'm raising a daughter and two young gentlemen. And I just want to be someone that leads by example in my family. And I think from an organization perspective is how do I push the needle today that I wasn't able to do tomorrow? So
Nice.
it's always this kind of burning of staying hungry and wanting to, how do we say it, kind of move mountains every day that I have the opportunity with my organization. So it's kind of a multitude of things, but it's all about improvements for my community and my patients. And it's all about building a strong foundation at home.
That's really inspiring. And I would also think is the same kind of thing you look at when you're not motivated, when you have those great days. Do you also remember that, like, this is okay, this is why I started, I need to continue?
Yeah, you sometimes have to go backwards a couple times to go
Yeah, of
forward a few steps, right?
course.
To your point, it's always about embedding yourself into those things that drive you. What makes you put your pants on one leg at a time, so to speak, and keeping that to you and staying true to that. I think if you're able to do that and you're able to wash off the things that would get in the way of those, let's say, principles or values or morals, how you want to connotate it, I think you'll be more successful as a leader and you'll keep waking up sometimes with a little war pain underneath the eyes, but you will wake up and tackle those challenges that are set forth.
Really nice, very inspiring. Jay, what's one app or a tool you can't live without?
I'm a tech guy and,
Yeah, exactly.
when
I
you
want to
took
know.
this over, it was like, yeah, but if I didn't have that, I could do this, right? Like I'm strategizing. It's probably something very simple, and I think this is not too exciting, right? It's Microsoft Teams, and I know that's not that exciting, but it is a one source of communication that I can
Yeah,
have my team on, my leadership team on, my peers on, and with all of the different bells and whistles, so to speak, that you can have from a collaboration and communication tool, at least something that would make me have an interesting day if it just vanished. But to the point on this, I could pivot and go to another communication platform, but it probably would be Microsoft Teams.
nice. Absolutely. I think, especially from 2020 with COVID hit, Microsoft Teams was one of the top, definitely, apps that you have to use. If you're working somewhere, stay connected, and really nice to hear.
Team on that. Now that Copilot kind of has been buried within it, it makes it even more of a robust tool
Yeah,
set, right?
definitely. If you weren't in the digital transformation healthcare world, what would you been doing today?
Yeah, I was thinking about this. Like everyone tells me I was in marketing before, right? In a previous life, I was doing something in marketing. So I don't know if I would gravitate towards that, but to me, I'd probably have a small consulting firm. I'd be probably building teams and strategies and solutions because I love to problem solve. So that's kind of where I would see myself if I wasn't specifically in healthcare digital transformation.
Really cool. And I definitely agree with that. You would be absolutely great in marketing and that Definitely, definitely. From knowing you. The last question of the podcast, which is the famous one. What does level up means to you?
Yeah, I mean, level up to me means many things, Hakeem. It's all about every day making yourself better and the people around you better for the betterment of your constituents, being it staff, being it your company you're working for, or people that you're serving. And in my case, it's patients. So my level up is to make sure that I come to work every single day, bring the best that I can, and make the people around me bring their A game as well.
That's really inspiring and motivating. Absolutely. And I want to take this chance really to, appreciate you as a good person in my life, a friend and also business partner. We worked together before, so it has been a pleasure, all these years and seeing you growing and most importantly, staying in touch. If I go back to my career, one of the most valuable assets of my career is the people I know. Definitely, I want to thank you for that. And yeah, it has been a pleasure having you. Thank you for.
Thank you, Hakeem. It's always a pleasure. It's great to see you. And I just look in 15 years, what podcast we're going to be talking about,
Yes,
right?
you never know. Never know. I really appreciate your time today, especially in a busy Monday. So thank you. I wish you all the best. Please stay in touch, and we definitely continue staying in touch together.
Thank you, Hakeem.
Thank you.